If a stroke were coming for you in the next few months, you'd want to know. Not the day it happened, not the hour, months before. And here's what almost no one over 60 is told. The warning may not start where you've been trained to look. It may not start in your face. It may not start in your arm. It may not start in your speech. It may start somewhere much lower, much quieter, and much easier to ignore. It may start in your toes. I know how that sounds. Toes and stroke seem to live in two completely different worlds. One is at the very bottom of your body. The other happens at the very top, in the brain. But that distance is exactly why this warning is so valuable. When something goes wrong with the blood vessels that eventually feed the brain, the damage almost never starts in the brain itself. It starts in the smallest, farthest, most delicate vessels in your body first. And the farthest vessels you own are sitting inside your toes. So here's the sign. In many older adults, weeks or even months before a stroke, one or both toes begin to change. The color shifts. A bluish, purplish, or unusually pale tint that comes and goes. The temperature drops, one toe noticeably colder than the ones next to it, even in a warm room. Or the sensation changes, a faint tingling, a numb spot, a strange pins and needles feeling that shows up for a few minutes and then disappears like nothing happened. Most people brush it off. They pull on a warmer sock. They blame the weather. They tell themselves it's just circulation, just age, just the way things are now. And that's exactly why this sign is so dangerous. Not because it's loud, because it's quiet. Doctors have a name for the underlying problem: peripheral vascular changes. In plain English, it means the same disease process that eventually blocks blood flow to the brain often shows itself first in the tiny vessels of the feet. Your toes become a kind of early warning light on the dashboard, and most people never think to check it. Now let me be clear about something because I don't want to scare anyone unnecessarily. A cold toe on a January morning is not a stroke warning. A little numbness after sitting cross-legged for an hour is not a stroke warning. What we're talking about is a pattern, a change that shows up more than once, a toe that behaves differently from the others without a clear reason, a sensation that keeps returning even when your feet are warm and your shoes fit right. That pattern, that repetition, is what turns a small oddity into a message. And in the senior years, that message deserves attention. The tragedy is that this sign is often visible for weeks, sometimes months. It sits there, in plain view, every time you take off your shoes at the end of the day. And still, the vast majority of people who go on to have a stroke never noticed it. Or if they did notice, no one told them what it meant. So the real question isn't whether the body warns you. In many cases, it does. The real question is why this particular warning gets missed by almost everyone, including sometimes the doctors themselves. That's exactly where we're going next. Think about the last time you noticed something odd about your feet. Maybe a toe that felt colder than the rest. Maybe a small patch of skin that looked a little off. What did you do about it? If you're like most people over 60, you did what almost every senior in America does. You looked at it for a moment, shrugged, and moved on with your day. Maybe you thought, my circulation isn't what it used to be. Maybe you thought, it's cold in here. Maybe you thought, I've had this for years, it's nothing new. That reaction is not a personal failure. It's how we've all been trained to think about our feet. Feet are the part of the body we take for granted. They carry us around for decades without complaining much. So when they do send a small signal, we don't take it seriously. We reserve our worry for the chest, the head, the heart, not the toes. And here's the second layer of the problem. Even when a senior does mention it to their doctor, the conversation often ends quickly. The doctor hears cold toe or numb toe and reaches for the most common explanation: diabetes, neuropathy, poor circulation from age, tight shoes. Sometimes those explanations are correct, but sometimes they're the top of a much deeper story. And the deeper story never gets told because the appointment moves on to blood pressure and cholesterol and refills. There's a reason for that too. Doctors are trained to look upward when they think about stroke. They check the carotid arteries in the neck. They listen to the heart. They ask about headaches and vision and speech. All of that is important, but almost no one is taught to look downward first. Almost no one is taught that the smallest vessels tell the story before the biggest ones do. So the toe sign slips through the cracks, not out of carelessness, but out of habit. Then there's a third reason this warning gets missed, and this one hits closer to home. Many seniors simply don't want to bring it up. They don't want to sound like they're complaining. They don't want to seem like the patient who's always finding something new to worry about. So they hold the observation quietly. They tell their spouse maybe. They tell no one more often. And a sign that could have started a very important conversation stays locked inside a slipper. Add one more layer. The sign itself is sneaky. It comes and goes. A toe that looked bluish on Tuesday looks perfectly fine on Wednesday. A tingling that woke you up at 3 a.m. is gone by breakfast. When a warning disappears on its own, the mind files it under probably nothing. That's human nature. But in this case, the disappearing act is exactly what makes it dangerous. Intermittent signs are still signs. Sometimes they're the most important ones. So put all of this together. A body part we don't watch, a symptom we don't respect, a conversation that rarely happens, a medical culture that looks up instead of down, and a warning that keeps politely vanishing before we take it seriously. That's how a sign that shows up months before a stroke becomes a sign that almost no one acts on. And it's exactly why we need to talk. Next, about what is actually happening inside the body when your toes start whispering. Because once you understand the mechanism, you'll never look at your feet the same way again. To understand why a toe can warn you about a stroke, you have to picture what your circulatory system actually looks like on the inside. Most people imagine it as a simple set of pipes carrying blood in a loop. It's not. It's more like a river system. A few large rivers at the center, your aorta, your carotid arteries, branching into smaller streams, then into thousands of tiny creeks, and finally into vessels so narrow that blood cells have to pass through in single file. Those tiniest vessels are called microvessels, and the largest concentration of them, at the farthest point from your heart, sits inside your toes. Now here's the part almost no one explains to seniors. The disease process that eventually causes most strokes doesn't start in the brain. It starts in the walls of the arteries, all over the body, at the same time. Doctors call it atherosclerosis. In plain English, it's the slow buildup of fatty deposits and stiffening inside your blood vessels. It's been developing quietly for decades, long before anyone notices it. Here's the key. That buildup doesn't affect all vessels equally at once. The tiniest vessels, the microvessels in your feet, your toes, your fingertips, feel the squeeze first. They have less room to spare. When the flow slows down by even a small percentage, the largest vessels can compensate. The smallest ones cannot. So the toes become the first stage where the damage shows itself in a visible, feelable way. That's why a bluish tint, a cold spot, or a strange tingling in a toe isn't just a foot problem. It's a message from the entire circulatory system. It's your body's way of saying, the plumbing isn't working the way it used to, and the plumbing that feeds your brain is part of the same system. Then there's the second piece, clots. Small clots form more easily as we age, especially if there's any irregular heartbeat, any arterial narrowing, any inflammation running quietly in the background. Most of these tiny clots don't cause a full stroke. They travel through the bloodstream and lodge somewhere small. Sometimes that somewhere is a toe. When a microclot blocks a tiny vessel in the foot, you may see a purplish patch, a sore that heals slowly, or a toe that suddenly feels different from the rest. That's called a warning event. It's not a stroke, but it's coming from the same factory that makes strokes. And if it's happening in the toes today, the same mechanism is capable of sending a clot to the brain tomorrow. There's also arterial stiffening to consider. As the walls of your arteries lose their flexibility, they can't expand and contract the way they used to. Blood pressure spikes and dips become harder to manage. The tiny vessels, again, feel it first. You may notice that your toes get colder faster, that circulation seems slower to return after you cross your legs, that the color takes a few extra seconds to come back after you press on the skin. These are not random quirks. They are readings on a gauge most people never learn to check. So when you put it all together, narrowing vessels, sluggish flow, small clots, stiffening walls, you begin to see why the toes are not a separate story from the brain. They're the same story, told at the far end of the body first. And once you understand that, the next question becomes very practical. What exactly are you supposed to look for? Take off your shoes tonight, sit under a good light, and really look at your feet for the first time in years. Because the signs we're about to walk through are the ones that show up in plain sight, if you know what you're looking at. The first sign is color. A healthy toe should look roughly the same shade as the toes around it. What you're watching for is a toe that starts drifting into a different color from the rest. A bluish tint, a dusky purple, a strange pale spot that doesn't quite match its neighbors. Sometimes it's just one toe, sometimes it's the tip, sometimes it's the underside near the pad. And here's the important part. The color often comes and goes. You may see it in the morning and not at night. You may notice it after sitting for a while, then watch it fade when you stand up. That coming and going pattern is not reassurance. It's a signal that blood flow is fluctuating in a way it shouldn't. The second sign is temperature. Run the back of your hand gently across the tops of your toes. Then compare them, one to the next. In most people, they feel almost identical. What you're checking for is one toe, or one small area, that feels noticeably cooler than the rest, in a warm room, at a normal time of day. Not, my feet get cold in winter. That's most of us. What we're looking for is a temperature difference between one toe and its neighbors when nothing else explains it. The third sign is sensation. This is the one seniors mention least because it feels too small to matter. A brief tingling, a patch of numbness the size of a dime, a pins and needles feeling that visits for 10 minutes and then leaves. Sometimes it wakes you up at night. Sometimes it shows up when you're just sitting in your chair reading. If it keeps returning, especially in the same toe or the same spot, it's worth writing down. The fourth sign is a sore that won't heal. This one is more familiar to people with diabetes, but it applies to any older adult. A tiny cut, a small blister, a scrape from a shoe that would normally close up in a few days, and instead, it lingers. It stays open for a week, 2 weeks, longer. That slow healing is a direct reflection of poor blood flow reaching the tissue. The blood isn't delivering what the skin needs to repair itself, and if it can't repair a tiny sore, that tells you something about the entire delivery system. The fifth sign is one most people never think about: hair loss on the toes. Yes, toes have small hairs, and healthy circulation keeps them growing. When blood flow drops, those hairs are among the first things the body sacrifices. If you notice that the tops of your toes have gone completely smooth when they used to have fine hair, that's not a cosmetic issue. That's a circulation clue. The sixth sign is the toenail. A nail that suddenly stops growing. A nail that becomes thick, brittle, or discolored without a fungal cause. A nail that lifts slightly from the bed. Nails need blood too, and when they stop behaving normally, the vascular story is often part of the explanation. Now here's the piece that ties all of this together. You are not looking for one sign in isolation. One cold toe on a January morning proves nothing. What matters is a pattern, 2 or 3 of these signs showing up in the same foot, in the same toe, or in the same person, over the course of weeks or months. That pattern is what turns a small observation into a real warning. And here's where it becomes even more important. Because these toe signs almost never travel alone. They usually bring a few companions with them, signs that most people brush off as separate problems entirely. Here's something that changes the whole picture. When the toe signs we just talked about are actually pointing toward a future stroke, they rarely show up by themselves. The same underlying problem, narrowed vessels, sluggish flow, tiny clots, is affecting the rest of the body at the same time. It just shows up in different disguises. And most seniors treat each disguise as a separate little annoyance, never realizing they're all telling the same story. The first companion sign is brief dizziness. Not the room-spinning kind, the subtle kind. You stand up from a chair, and for 2 or 3 seconds, the world feels slightly off. You steady yourself on the counter. It passes. You forget about it. But if that's happening more than it used to, and you're also seeing changes in your toes, those 2 observations belong in the same sentence, not 2 different ones. The second is one-sided fatigue, a strange, quiet heaviness that shows up in one arm or one leg after ordinary activity. You carried the groceries in, and one arm feels more tired than the other. You walked to the mailbox, and one leg felt slower coming back. Most people blame the shoulder, the knee, the hip. Sometimes that's exactly right. But when it keeps happening on the same side, it deserves a second look. The third companion sign is a small change in handwriting. Pull out a birthday card you signed a year ago and compare it to one you signed last week. If the letters have gotten smaller, shakier, or harder to control, and you can't blame arthritis or a new medication, that's a neurological breadcrumb. Small, but real. The fourth is balance, not falling, just small slips, reaching for the wall a little more often, feeling less sure on stairs, standing on one foot to put on a sock and suddenly needing to grab the dresser. These are not just aging. They can be early signs that the brain is not getting the steady blood flow it needs to keep everything coordinated. The fifth is nighttime leg cramps that have gotten worse. Almost every senior has had a leg cramp at some point. What we're paying attention to is a change. Cramps that used to be rare and are now weekly. Cramps that wake you from a sound sleep. Cramps in the calf or the foot that come with cold toes and slow healing skin. That combination is not random. The sixth companion is a change in energy that doesn't quite match your day. You slept well, you ate well, you didn't do anything unusual, but you feel drained in a way you can't explain. When circulation is quietly declining, the whole system works harder for the same output. Fatigue without a reason is the body paying that extra tax. Now here's the important thing to hold on to. Any one of these signs, on its own, means very little. Everyone has an off day. Everyone stumbles on a stair. Everyone has a night with a bad cramp. What raises the flag is when several of these show up in the same person, in the same season, along with the toe signs from the last chapter. That clustering is what doctors call a pattern of concern. And it's the pattern, not any single symptom, that tells you the body is trying to say something serious. If you're recognizing yourself in more than one of these, don't panic. But don't dismiss it either, because before we talk about what to do about it, we have to talk about something else first. The everyday habits that quietly make all of this worse without anyone realizing. Now here's where a lot of people, without meaning to, work against their own body. The signs are there, the pattern is forming, and in the middle of it, ordinary daily habits, the kind nobody thinks twice about, quietly pour fuel on the fire. Let's walk through them, because these are the ones you actually have control over. The first mistake is the "it comes and goes, so it must be nothing" habit. A toe looks a little dusky in the morning, fine by lunch. A tingling wakes you at night, gone by breakfast. Most seniors take the disappearance as proof that everything is okay. But intermittent is not the same as harmless. Intermittent is often exactly how vascular problems introduce themselves. Writing off a symptom because it left on its own is the single most common mistake in this entire story. The second mistake involves aspirin, and this one is delicate. Some older adults are on a daily low-dose aspirin. Some have been told to stop. Some started on their own and never told the doctor. The mistake isn't in which camp you're in. The mistake is not having a clear conversation with your doctor about it, especially if you're seeing the signs we've talked about. Aspirin is not a decision to make in the pharmacy aisle. It's a decision to make in the exam room, with your full picture on the table. The third mistake is dehydration, and this one is almost universal after 60. The thirst signal weakens with age. Many seniors go the entire day on 2 or 3 small glasses of liquid, most of it coffee or tea. Thicker blood moves more slowly, slower blood clots more easily, and the smallest vessels, again, the ones in your toes, feel the effect first. If you're seeing the signs, you cannot afford to be even mildly dehydrated. Steady water throughout the day matters more than most people realize. The fourth mistake is the hot shower or the heating pad on cold feet. It feels wonderful in the moment. The problem is that if reduced blood flow is the reason your toes are cold, heat doesn't fix it. And if sensation is already dulled, you can burn the skin without feeling it. A sore from a heating pad on a compromised foot can turn into a weeks-long healing problem that shouldn't have happened at all. The fifth mistake is crossing the legs for long stretches. In a younger body, it doesn't matter much. In a senior body with vessels already under strain, 30 or 40 minutes of pressure at the back of the knee is enough to slow flow significantly. Watch television with your feet flat on the floor or elevated. Save the crossed leg pose for shorter moments. The sixth mistake, and this one is serious, is stopping a statin, a blood pressure medication, or a blood thinner without medical guidance. Sometimes side effects push people to quit quietly. Sometimes a well-meaning relative shares an article. Whatever the reason, silently stopping one of these medications while your body is showing early vascular signs is one of the riskiest choices a senior can make. If the medication is a problem, the answer is a conversation, not a disappearance. And the last one is subtle: long stretches of sitting. Retirement, unfortunately, often means more chair time. 2-hour stretches without standing up allow blood to pool in the legs. Every hour, get up, walk to the kitchen, walk to the mailbox, move for 2 minutes. It's the cheapest, simplest circulation medicine there is. None of these mistakes are shameful. Most of them are just human. But once you know they matter, you get to make different choices. And that's exactly where we go next. The specific steps to take if you're actually seeing these signs on yourself or someone you love. So let's say you've been listening, and something in this video has landed. Maybe you look down at your own feet. Maybe you thought about your husband, your wife, your father, your mother. Maybe 2 or 3 of these signs are ringing bells you didn't want to hear. The question now is simple: what do you actually do about it? Start with documentation. This is the step most people skip, and it's the one that changes everything. Grab your phone. Take a clear photograph of the toe under good light. Note the date. Note the time. Note whether the room was warm or cool. If the sign comes and goes, take a photo each time it appears. Within a week or 2, you'll have something no doctor can dismiss: a visible pattern with dates attached. That kind of evidence turns a vague complaint into a real medical conversation. Second, book an appointment. Not the emergency room, unless the sign is sudden and severe. A regular appointment with your primary doctor. And be specific when you call. Say the words out loud. I'm seeing changes in one of my toes and I'm concerned about my circulation. Those words get you a longer visit than, I need a checkup. Third, know what to ask for. This is where you become your own advocate. Ask about a vascular assessment. Ask about an ankle brachial index, a simple, painless test that compares blood pressure in your ankle to blood pressure in your arm. It takes about 15 minutes, and it tells the doctor a great deal about the health of your peripheral vessels. Ask, when appropriate, about a carotid ultrasound, the test that looks at the arteries in your neck that feed the brain. And ask whether your medications, your cholesterol picture, and your blood sugar picture all fit together the way they should. Fourth, review your medications together. Bring every bottle, every supplement, every over-the-counter tablet you take regularly. Sometimes a small adjustment, a dose, a timing, a substitution, makes a bigger difference than any new prescription. And this is the moment to have the aspirin conversation, the blood thinner conversation, the statin conversation. Not on the internet, in the room, with the doctor, with your full picture in view. Fifth, address the daily habits we talked about in the last chapter. Water throughout the day, standing up every hour, feet flat on the floor, no heating pads on numb skin, no silent quitting of medications. These aren't dramatic changes. They're small, steady corrections. But when circulation is already under strain, small corrections matter enormously. Sixth, know the difference between call the doctor this week and call 911 right now. A toe that's been dusky on and off for a month is a scheduled visit conversation. But if the toe becomes suddenly and severely painful, turns dark blue or black, or you develop facial drooping, arm weakness, slurred speech, or sudden vision changes, that's not a phone call. That's an ambulance. Every minute matters when a stroke is actually in progress. The old rule still applies. Face, arms, speech, time. If any of those show up, you don't wait, you don't drive yourself, you call for help immediately. And finally, tell someone, a spouse, an adult child, a close friend, someone who will notice if something changes about your speech, your walking, your face. The people around you are part of your monitoring system, and most of them want to help. They just need to know what to watch for. None of this is panic. All of it is attention. And attention, in the senior years, is one of the most protective things you own. Here's what I want you to take with you when you close this video. A stroke almost never arrives without a messenger. That's the truth that gets lost in the noise. Most of the time, the body has been trying to say something for weeks, sometimes months, before the event that changes everything. The messenger is just quiet. It doesn't knock loudly. It doesn't announce itself in the chest or the head. It shows up in a small, easily ignored place. A toe that looks a little off. A toe that feels a little cold. A toe that tingles for 10 minutes at 3 in the morning. We've been trained to watch the big things. Blood pressure numbers, cholesterol reports, the bathroom scale. Those matter. But the body doesn't only speak in numbers. It also speaks in small, physical clues that never show up on a chart. And after 60, learning to listen to those clues may be the most important skill you can develop for yourself. I want to be careful here. Watching your toes is not paranoia. It's not hypochondria. It's not overreacting. It's the same kind of quiet attention a farmer pays to the sky or a captain pays to the water. You're not looking for disaster. You're looking for changes, small ones, the kind that means something is shifting before the storm arrives. And here's the reassuring part. If you catch this sign early, you have time, real time, weeks, sometimes months, time to talk to a doctor, time to adjust a medication, time to change a habit, time to run a test that might reveal exactly what's happening in your vessels before the vessels reveal it themselves in a much more painful way. That window is a gift. Most people never know they had it. So tonight, before bed, take your shoes off and really look at your feet. Compare the toes to each other. Feel the temperature. Notice the color. Notice the skin. Do the same thing next week and the week after. If everything looks the same, wonderful. That's the answer you were hoping for. If something looks different, don't panic, but don't shrug either. Take a picture. Write the date down, and make the appointment. If this video helped you see something you'd been overlooking, share it with someone you love, a husband, a wife, a parent, a friend from church. The people we care about often need to hear these things from us, not from a stranger on a screen. And if you'd like more videos like this one, calm, direct, protective, made for older adults who want to stay sharp and stay independent, subscribe, and I'll keep making them for you. Take care of your feet. They've been carrying you your whole life. It turns out they may also be trying to protect the part of you that matters most.